Welcome all to Nursing Officer Exam Preparation with Important Multiple Choice Question Discussion Part 3.
The question: which of the below disease is not transmitted by Culex mosquito? Option A: avian malaria. Option B: filariasis. Option C: Japanese encephalitis. And option D: malignant malaria. Let us see the right option. The right option is option D: malignant malaria. Here you have to see the types of mosquitoes which transmit diseases: Culex, Anopheles, and Aedes mosquitoes. Culex, you have to remember short word JAF, that is Japanese encephalitis, avian flu, and filariasis. So, Japanese encephalitis, avian flu, and filariasis is caused by the Culex mosquito. Aedes mosquito is transmitting five diseases, that is MYDCZ, Mayaro fever, yellow fever, dengue fever, chikungunya, and Zika fever. And Anopheles mosquito is transmitting the malaria. So remember these codes for these three types of mosquitoes and their related diseases. Next question: the paraphilia in which a person becoming sexually aroused by watching an unsuspecting person who is disrobing, naked, or engaged in sexual activity is option A: voyeurism, option B: masochism, option C: fruitorism, and option D: fetishism. Let us see the right answer. Here the right answer is voyeurism. Here these all are the paraphilias: voyeurism, masochism, sadism, fruitorism, and fetishism. You just remember this code for better memory: voyeur watch, fruiter rub, maso self, sad others. Voyeurism is getting the sexual pleasure by watching nakedness or sexual activity. Masochism is getting the sexual pleasure by inflicting pain on self. Sadism, on the other way, getting the pleasure by inflicting pain on others. Fruitorism is getting the pleasure by rubbing the organs. Fetishism is getting the sexual pleasure from objects like clothes, undergarments, etc. Next question: the tubular glands that lie between the finger-like projections of small intestine villi called villi is A. Clara cells, B. Cisterna chyli, C. Crypts of Liberconch, and D. Peyer's patches. The right answer here is crypts of Liberconch. This is the finger-like projections of the small intestine called villi. Next question: the facial nerve is the A. Sixth cranial nerve, B. Seventh cranial nerve, C. Eighth cranial nerve, and D. Ninth cranial nerve. The right answer here is seventh cranial nerve. So the facial is seventh cranial nerve. You can see the symbol short form for the 12 cranial nerves: OOOTT, AFV, GVAH. Here you can see the color codes. Green is for sensory. Sensory is afferent nerves. That also a question. I already discussed in the previous topics afferent and efferent nerve. Motor is efferent nerve. So this green is for sensory, blue for motor, and gray for mixed. There are three sensory nerves, that is 1, 2, and 8. Four mixed nerves, that is 5, 7, 9, 10, and 5 motor nerves, that is 3, 4, 6, 11, 12. You can see this chart for the better memory with the color codes. See, the green colors are for the sensory or afferent, blue for motor or efferent, and gray for the mixed. Here you can see the functions also. So just remember this chart and note it down for the better memory for the cranial nerves in your exams. Next question: sebaceous gland in areola of breast is termed as A. Montgomery tubercle, B. Bartholin's gland, C. Fimbriae, D. Skene's gland. The right answer is Montgomery tubercles. Here the glands are Montgomery tubercles are small bumps of on the areolas that produce oil to lubricate the nipple. The Bartholin glands are located on each side of the vaginal opening. Skin's glands are two glands located on the lower end of urethra in women. So these two, Bartholin and skin glands, are related to reproductory or urinary system, and Montgomery tubercles is seen in the areola of breast near the nipple to lubricate it. Next question. Gray baby syndrome is caused by the accumulation of antibiotic. Option A, vancomycin. Option B, chloramphenicol. Option C, streptomycin. And option D, isoniazid. Here the right option is option B, chloramphenicol. I already discussed the table. Just for a refresher, I will tell you again. Red one, grey chlor, blue night, brown gypsy. So blue baby syndrome is caused by nitrate or by methoglobinemia. Then the gray baby syndrome is caused by the chloramphenicol. Then red man syndrome is caused by the antibiotic vancomycin, and the brown sequard syndrome is characterized by ipsilateral paralysis. That's why we term it as brown gypsy. So red van, grey chlor, blue night, and brown gypsy. Next question. In which of the following conditions there is a risk of hyperkalemia? Option A, colitis. Option B, laxative use. Option C, Cushing syndrome. Option D, Addison's disease. Here it is a tricky question in which we can see the answer Addison's disease. Here Cushing's and Addison disease are opposite, so you have to focus on only these two options here. One of this will be the right one. How you will identify which is the right one? That's why we will go to the table to compare and contrast the characteristics of Addison disease and Cushing's disease. Cushing's is hyperpituitary thyroidism and Addison's is hypopituitary pituitarism. So Cushing's is for hyperactivity of pituitary, Addison's is for hypoactivity of pituitary. See here the characteristics. Cushing's it is water excess, Addison's it is dehydration. Cushing's it is hypertension, Addison's it is hypotension. Cushing's it is hyperglycemia, Addison's it is hypoglycemia. Cushing's it is hypernatremia, Addison's it is hyponatremia. Cushing's it is hypokalemia. So this is the only one where it is coming hypo. All other are hyper only. So this nature of Cushing's is hyper. So most is hyper only. Water is hyper. BP is hyper. Sugar hyper. Sodium also hyper. But only potassium is hypo. Here everything is hypo or low. Only potassium is high. So remember in this way. Compare and contrast. Next question. A patient generates a false memory without the intention of deceit is termed as A, loose association, B, clang association, C, confabulation, D, derailment. The right answer here is confabulation. Here, false memory confabulation. Fa. See, this is the short-term memory trick. And the explanation here is loose association involved jumping from topic to topic. Derailment is also almost same, a lack of connection between the ideas. Whereas the clang association is a disorganized speech pattern that involves using rhyming or similar sounding words. So this is about the psychiatric terms: loose association, derailment, clang association, confabulation, etc. Next question. Hyperthyroidism is characterized by all the below except option A, weight loss, option B, tachycardia, option C, cold intolerance, option D, heat intolerance. Here is also the similar way. Two options you have to focus and try to answer this question. The right answer is cold intolerance. Here also similar way you have to identify the hyperthyroidism and hypothyroidism with compare and contrast characteristics. Similarly, you have did it for the hyperpituitarism Cushing's and hyperpituitarism Addison's. The same way you have to do and remember all these tables for your exam. Hyperthyroidism, weight loss, tachycardia, heat intolerance, hair growth and sweating. Here the opposite here. Hypothyroidism, instead of weight loss, weight gain. Instead of tachycardia, it is bradycardia. Instead of heat intolerance, it is cold intolerance. Instead of hair growth, it is hair loss. And instead of excess water or sweating, it is skin. Next question. The National Rural Health Mission NHRM is launched in option A 1991, option B 2004, option C 2005, option D 2013. Here you have to remember the year by heart. The right option is 2005. The NRHM is launched in 2005. Next question. The umbilical vein after birth becomes option A umbilical ligament, option B ligamentum teres, option C ligamentum venosum, option D ligamentum arteriosum. The right option here is ligamentum teres. Next question. The hormone which prevents immune rejection of fetus is option A luteinizing hormone, option B HCG, option C FSH, option D MSH. The right option here is HCG. HCG is the human chorionic gonadotropin, a hormone produced by the placenta during pregnancy. FSH and LH, we can see the functions. FSH is responsible for estrogen or estradiol release, ovum development, ovarian follicle development and sperm maturation. Whereas LH or luteinizing hormone is responsible for progesterone release, ovum release, corpus luteum development and testosterone secretion. Next question. This is an application level question, so you have to read it carefully. A nurse is taking care of the patient with fluid electrolyte imbalance. She notices that there is redness around the IV cannula. After touching, she found out that there is tenderness and IV flow is also decreased. What is the correct interpretation of the following condition and the action? Option A, finding is normal after cannulation, continue the IV flow. Option B, the finding is abnormal, there is sepsis, stop the IV flow, remove cannula. Option C, finding is abnormal, there is phlebitis, stop the IV flow, remove cannula. Option D, the finding is abnormal, wait for physician to provide you the order. Here the right answer is finding is abnormal, there is phlebitis, stop the IV flow and remove the cannula. So this is application level question and you have to see the priority and guidelines and negative words also sometimes. So here you can see the finding is abnormal, so this first option is eliminated. Then the last option, the finding is abnormal, wait for the physician to provide the order. Though for an IV line blockage and all, in very rare situations you need physician order, otherwise you have to intervene by yourself. So this also eliminated. So here the priority is for these two similar options. The finding is abnormal in sepsis, in phlebitis, though all the other things are same, stop the IV flow and remove cannula. So you know when there is blockage and redness and the fluid is not going, then you have to stop the flow and you have to flush and remove sometimes. So the right thing, but here it is answer is phlebitis. So when the redness is there and IV is blocked, so most likely it will be phlebitis. Sepsis is a complicated term, you need blood reports, you have to see the vitals, temperature rise, tachycardia, all those is associated with sepsis. No data here, so you have to eliminate this option. So this way you have to answer the application level questions. Next question. DNA has all the following nucleotides or bases except option A adenine, option B thymine, option C uracil, option D cytosine. The right answer is uracil. Here also you can see the word except, that is a negative word. So all these other DNA is having, adenine, thymine and cytosine is having, uracil is not having. You can see the chart here. DNA, thymine, RNA instead of thymine, uracil. So RNA is having uracil. DNA bases are adenine, thymine, guanine and cytosine. Adenine pair with thymine and guanine with cytosine. RNA has no thymine and instead uses uracil. So the right answer here is uracil. Next question. Tubules of kidney is made up of which type of epithelial cells? Option A, simple squamous. Option B, columnar. Option C, cuboidal. And option D, ciliated. The right answer here is cuboidal. You can see the table here. The types of squamous cells. Simple squamous is found in blood vessels, lymph vessel, alveoli of lung. Cuboidal is found in tubules of kidney and some glands. Columnar is found in lining of organs of alimentary canal. So columnar, alimentary canal. Cuboidal, tubules of kidney. Ciliated find in lines of uterus tube, respiratory passages. Here you can see the cilia is present, and this is for the movement of particles which is required in uterus, respiratory passage, etc. Next question. The transition epithelium found in which of the following? Option A, organs of alimentary canal. B, dry surface of skin. C, wet surface of mouth, vagina, etc. D, found in urinary bladder. The right answer is found in urinary bladder. You can see the stratified epithelium is having two types, keratinized and non-keratinized. This is keratinized is found in dry surfaces, non-keratinized is found in wet surfaces. Transitional epithelium is found in urinary bladder. So the right answer is transitional epithelium. Next question. The type of connective tissue which involves in active tissue repair or wound healing is option A, fibroblasts. Option B, adipocytes. Option C, macrophages. Option D, mast cells. The right answer here is option A, fibroblasts. Here you can see the different type of connective tissue. Fibroblasts are collagen and elastin fibers, active tissue repair and wound healing. So this is involved in active tissue repair and wound healing, fibroblasts. Fat cells are adipocytes. Macrophages are phagocytosis or defense mechanism. Leukocytes, synthesis of antibodies, and mast cells are producing histamine and heparin. It is seen in liver and spleen. So these are the different type of connective tissues. Here the right answer is fibroblasts. These are involved in active tissue repair or wound healing. Next question. Kupffer cells found in option A, connective tissue. Option B, brain. Option C, kidney. Option D, liver. So these are the basic macrophages. So we will see the right answer. It is liver. So we will see different kind of macrophages and their locations. Histiocytes is found in connective tissue. Microglia is the type of macrophages found in brain. Kupffer cells are found in liver. Mesoglial cells are the macrophages of kidney, and osteoclasts are found in bone. Next question. Which of the following type of leukocytes found largest in number? Option A, basophils. Option B, neutrophils. Option C, monocytes. Option D, eosinophils. Let us see the answer now. The right answer is neutrophils. You can see the chart here. Granulocytes, the first three is granulocytes, then agranulocytes. So basophil, neutrophil, eosinophils are the granulocytes. Basophil found 0 to 1%, neutrophils 50 to 80%. This is the majority, and eosinophils 1 to 5%. And the agranulocytes, monocyte 2 to 6%, and lymphocyte 14 to 44%. Let us go to the next question. Vitamin K is essential for all the below clotting factors except option A, factor 2, option B, factor 7, option C, factor 8, option D, factor 9. The right answer here is option C, factor 8, because here is also you can see the word negative word, that is except. So vitamin K is essential for 2, 7 and 9. It is not needed for factor 8. You can see the chart here. Vitamin K is for factor 2, 7, 9 and 10. The memory tip is 2 plus 7 is 9. So these 3 is involved, plus 9 plus 1 is 10. So 2, 7, 9 and 10 is related with vitamin K. Remember this code. Thank you for watching this video, and more exam preparation videos will be uploaded soon. Stay tuned, like and share the video for the maximum reach, and I will come up with next video. Thank you so much.